Buenos días a todos.
Good morning, everyone.
Un domingo por la mañana.
Thank you for being here Sunday morning.
Quiero hablaros de esta conexión que necesitamos.
Today I would like to talk to you about this connection that we need to establish
trans y los sistemas sanitarios.
between trans people and the healthcare systems. Yesterday we were talking about the services specialized for the health for trans people, in our case in Catalonia for Trànsit. But today I would like to go further away from the specialized centers and see how we can connect the idea of to connect the services in general. It's this needs the relationship between the trans people and the centers needs to improve. We believe that we need to establish specialized services for the attention that are decentralized and that can be like the base for the community network to connect with the healthcare systems. On this topic, if we focus on the definition of health, they talk about a completely being like well-being, not only the not having illnesses or the lack of sickness. It needs to be integrated from a biosocial perspective. This is some statistics from the studies that they've made today in relation to trans people and healthcare systems. Unfortunately, this is a fact. Trans people, we suffer from social transphobia, either we like it or not. And there are studies that reflect this. According to the European blah blah blah, they manifest having suffered discrimination to get access to the healthcare systems. 39% was discriminated in the sanitary social. 42% when it comes to seeking job. Sorry, people, I lost it. There's another study made by Transgender Europe. 48.1. They have delayed having their first appointment in their primary healthcare due to their gender identity, and 25% said that they have felt discriminated by their doctor during the 12 months previous to this study. On the other hand, on a Spanish level, the LGBT Federation, they make a study from 2019-2021, and they have similar numbers. 33% of trans people, they don't go to the healthcare centers. 55% have delayed going to the healthcare due to their gender identity. 48% have felt discriminated in the healthcare sanitary system during the 12 months previous to the study. And trans and non-binary people are the people that go to the healthcare centers the less. Many times This is because of a lack of information, a lack of education. I can't believe that this discrimination is made on purpose. That's why I think it's super important, like I was saying before, to decentralize the services so that they are the ones that they create this network in collaboration with the rest of the professionals, the healthcare providers. This is how we're trying to do it from Catalonia, and this is our goal. And on this line of thought is where we are working for the last 5 years, after the new model has been approved. So, to these new networks, we have some recommendations to the healthcare providers. We recommend them that if they need to call someone out loud in a waiting room, please always do it with their surnames. Don't do it with their first name. To respect your felt name, is that how you say it in English? And their pronouns, even though the documentation, your personal information, says something else. And don't question the identity of the person, and try to create a safer space. Don't make questions about their bodies and sexuality unless it's really it's needed for that specific consultation, that specific appointment. And don't talk about their genitals unless it's with the consent for the person. Talk with the professional healthcare provider to try to minimize this type of unnecessary questions. To have a link with a person, the healthcare provider that's going to help us or support us, to minimize that we need to constantly go through these violent questions. If a trans person asks for specifically treatment, sanitary treatment in relation with the transition, to refer them to experts that can explain the protocol to them, but don't send them directly to the psychology or the psychiatrist unless the person asks you specifically. Being trans is not being sick or having mental to understand that all of us are diverse. I think I'm on time. To conclude, I would like to talk to you about connecting all of these ideas with what Lucas Platero called factors of health. He defines this in 4 of them: to have reasons to live, this kind of means that there is very little information about the violences and mistreatments that trans people suffer, and people that are under these minority identities. There's very little knowledge about these micro violences and mistreatments that we have to go through every day. It's very difficult to have reasons to live if someone is telling you that what happens to you doesn't happen to anyone else, or what happens to you, you're making your family suffer, or that you have a disorder. Or to go to an interview, like a job interview, and say That's, yeah, it's, well, really good. We will call you in a few days, and that call never comes. Or being in a like classroom studying and feeling that the teacher has a problem because you are making them feel uncomfortable, because you're making the attention like or that you are going to a working place and they put you apart in a corner so that you don't disturb anyone. It's very difficult to have reasons to live if we are living on this reality. Then he talks about I don't know how to pronounce this. Sorry, people. To try that these problems that we have at least don't affect us that much. I would like to turn that around about this definition about resilience, to get away the ability of the person and give it back, like throw it back to the context, to the environments that a priori, like, that's your problem, you need to solve it, it's not my problem, that's on you. We are people that we live in a society, in communities, and these solutions should be shared. We should have those environments that are able to be resilient, or like, so that they help us to survive. The third factor is social support. We refer to this support. Maybe we need to start letting go of that, what will people say, or those like cultures or religions, or that have like really deep ideologies. Try to let go of what the neighbor's gonna say and start thinking get independent, like get away from those ideas that sometimes like they are in the family context and they come from the family. Sometimes they come from like the roots from the medical system, or sometimes even from religions. So to start to like unlink ourselves from these ideas, so that we can also, so that they can be together, close, supporting trans people. And finally, he talks about optimism, but not optimism as in, I wake up one day and today the lottery, I'm gonna win the lottery. No, optimism in the sense of that you have this idea that your life is connected. It has a place of belonging. You belong somewhere. Optimism can happen because someone told you, how you look so good today. Your face looks so great. Hey, do you have any plans tonight? Do you want to go have some beers? So that you get invited to a birthday party. In conclusion, so that you feel that you belong part of the community and that you feel that your life is worth it. There's a reason for your life. So this is the idea that I wanted to share with you, to try to work on these factors of health on a community level, on a health sanitary level, so that we can have a place where we fit and that we can feel that we belong. Welcome to the rest of the workshops. Thank you, and we keep going.